And I'm pleased to be joined now by the Executive Director of the Seaway Valley Community Health Centre, here to talk about the important role health centres play in our community. So welcome to the show, Erin Killoran.
Thank you.
Great to have you here, and always great to talk about the great work that's being done at Seaway Valley Community Health Centre. But for those who aren't completely aware of what you do, tell us about the organization.
Yes, for sure. So Seaway Valley Community Health Centre is one of over 100 community health centres in Ontario. And we have a whole interprofessional, interdisciplinary team. So we have physicians, nurse practitioners, respiratory therapists, physiotherapists, social workers, dietitians, a whole team that works together to look at an individual's overall health and well-being and really support them in a holistic way. Locally, we are fortunate to have two community health centres, so ourselves and Centre Santé Communautaire de l'Estrie. And together we provide services to groups and populations who may face barriers to accessing the healthcare system.
Oh, fantastic. So the evidence does show that access to community health centres does improve health.
Right.
It reduces emergency room visits.
Yep.
And it also saves money. So what can you tell us about that?
Yeah, absolutely. So for a long time, community health centers have sort of flown a little bit below the radar in terms of the healthcare system. And we faced questions in the past around the costs, the benefits, and the sustainability. But we have a lot of evidence now that shows that community health centers, people who access care at community health centers use the emergency rooms less often. And that we actually expand access to programs and services overall, and by serving marginalized populations, they actually have better health outcomes when they access care at a community health center.
And how is community health proven?
So we know that through the evidence and the data that community health centers improve cancer screening rates, improve diabetes care, and the emergency room visits that I spoke about earlier, the savings there is about $27 million per year.
Wow, that is fantastic. So what else does community health services, how else does it help people?
Yep, so we help people by managing chronic conditions. So a lot of people in our community have respiratory conditions, have heart health issues. So we see a lot of progress with supporting them in the community. And we also do a lot of system navigation. So if you've had someone or you yourself have had to access the health and social care system, it can be very complicated. So we help with navigation of those services and actually help individuals access resources that might help them in maybe not the ways that you might think about. So we have people who help to access housing, may help addressing food security issues, and other social issues that may be impacting one's overall health and well-being.
Oh, that's fantastic. And certainly last week was Community Health and Wellbeing Week, and I got to see a few of the programs that are offered as well. So as you mentioned, it's not just that sort of primary care. There's a whole list of programs and other services that are part of it. So what do you feel needs to happen next?
Well, we feel very passionately that we want equitable health and well-being for everyone in our community, and that's our vision. But to do that, we really need to focus on building the healthcare and the workforce system of the future, and that's going to require investments. So we have been under-resourced for a long time, but we actually have worked recently very closely and in partnership with, there's 4 primary care healthcare organizations locally who've worked together. And we've submitted a funding proposal for $9.4 million that would create 64 new positions in our community focused on the healthcare system. And so our hope is, that's a big, lofty ask, but we know that primary care is the foundation of the healthcare system, and it needs to be improved to help the entire community and work in collaboration with other organizations as well. So we've partnered, so there's Seaway Valley, there's Centre Santé, which I mentioned earlier, the Glengarry Nurse Practitioner-led clinic, the Rideau St. Lawrence Family Health Team. We've all come together to put in this funding proposal and look at the primary care needs of our entire community. And so we feel that our local politicians understand the need. They're familiar with our services, so our hope is that they can help us advocate to the Ministry of Health and Ontario Health to be successful in receiving more funding for primary care in our community.
Well, Erin, we certainly know that the healthcare system is in a very integral time right now, a very important time in its history. And as you have alluded to, we have perfect templates of what the future could look like. So we wish you the best of luck with this advocacy and with your continued service of the community.
Great. Thank you so much.